Did you know that the 5-year survival rate for throat cancer can exceed 80% if it's caught early? That's why it's so crucial to recognize the warning signs before it's too late. Throat cancer, which affects areas like the pharynx, larynx, and tonsils, can sometimes hide behind symptoms we often overlook. We often brush off a cough or a hoarse voice, attributing them to a cold or overuse. But what if these seemingly minor issues are actually signaling something more serious? Today, we're diving into 7 warning signs that could indicate throat cancer and potentially save your life. Remember, knowledge is power, and understanding these signs could make all the difference. So let's get right to it. We've all had coughs that seem to stick around longer than we'd like, right? But have you ever stopped to think about what your cough is trying to tell you? If you're dealing with a cough that lasts for weeks without any other cold symptoms, it's a signal you shouldn't ignore. This isn't just about a tickle in your throat, it's about paying attention to your body's signals. Unlike the typical cough that follows a cold or allergies, this one persists no matter what remedies you try. You've tried cough drops, maybe even a spoonful of honey before bed, but nothing seems to touch it. It could be dry or it could bring up mucus. But the key thing is, it's not going away. Now, I'm not saying every cough is a sign of something serious, but a persistent cough, especially one that lingers for weeks on end, warrants attention. It's like a smoke alarm going off in your house. You don't want to ignore it. A cough like this could be your body's way of telling you something isn't right, especially when it disrupts your sleep or daily activities. Imagine waking up in the middle of the night gasping for air because of a coughing fit, or struggling to get through a conversation without pausing to cough repeatedly. That's your body trying to tell you something's off. So what should you do? If you have a persistent cough that's been hanging around for more than 2 to 3 weeks, it's time to schedule a visit with your doctor. They can assess your symptoms, run any necessary tests, and determine the underlying cause. Remember, early detection is key when it comes to most health conditions, and throat cancer is no exception. Our voice is such an integral part of who we are, and any changes to it can be unsettling. Have you noticed your voice becoming hoarse or raspy for no apparent reason? We all get that scratchy voice after shouting at a game or singing our hearts out at a concert. But if the hoarseness lasts for weeks without any obvious cause, it could be a red flag. Imagine waking up one day and your voice sounds deeper, scratchier, or weaker than usual. You haven't been sick, you haven't strained your voice, but something's just different. These subtle changes, like needing to clear your throat more often or struggling to project your voice, could be early signs that your vocal cords are being affected by something more serious. Persistent voice changes are one of the most overlooked signs of throat cancer. We often attribute them to a cold, allergies, or even just dry air. But when these changes persist for weeks on end, it's crucial to pay attention. Think about it. Your vocal cords are delicate structures, and any persistent irritation or inflammation can impact their ability to vibrate properly, leading to voice changes. So, when should you be concerned? If you experience hoarseness, a raspy voice, or any other voice changes that last for more than 2 weeks, especially if you're not sick, it's essential to consult with your doctor. They can examine your throat, assess your vocal cords, and determine if further investigation is needed. Remember, early detection is crucial for successful treatment. Addressing voice changes promptly can make a significant difference. Swallowing. It's something we do countless times a day without even thinking about it. But if you find it becoming increasingly difficult, feeling like food or liquid is stuck in your throat, or even experiencing pain while swallowing, this could be a symptom of throat cancer. Imagine this. You're enjoying a meal with friends, but every time you try to swallow, it feels like something's stuck in your throat. You might start avoiding certain foods, or you might find yourself eating much slower than usual. This isn't just an inconvenience, it's a sign that something might be wrong. Known medically as dysphagia, this issue may start small but can become a serious and painful problem over time, signaling the presence of a tumor obstructing the throat. Now, I understand that difficulty swallowing can be caused by a number of things, from acid reflux to muscle disorders. But when it's persistent, especially if it's accompanied by other symptoms like unexplained weight loss or voice changes, it's crucial to seek medical attention. Early detection is key when it comes to throat cancer, and addressing swallowing difficulties promptly can significantly improve treatment outcomes. Your doctor can perform a thorough examination, order imaging tests if necessary, and determine the underlying cause of your discomfort. Now, losing weight might sound like a positive thing, and for many, it is a goal they're actively working towards. But what if the pounds start dropping without any effort on your part? When it happens unexpectedly, without changes to your diet or exercise routine, it's time to pay attention. Imagine this. You step on the scale one morning and you've lost a significant amount of weight even though you haven't been trying to. Your clothes feel looser, your friends might even compliment you on your weight loss. But deep down you know something's not right. Unexplained weight loss can be a sign that your body is struggling with something serious like throat cancer. This symptom could be linked to difficulty swallowing, making it harder for you to eat properly, or it could be due to your body's increased effort to fight off the disease. Now, I'm not saying that every time you lose a few pounds you should panic, but if you experience significant weight loss, especially if it's accompanied by other symptoms like difficulty swallowing or persistent fatigue, it's crucial to consult with your doctor. They can assess your overall health, run any necessary tests, and determine the underlying cause of your weight loss. Chapter 5. Swollen Lymph Nodes. Our lymphatic system plays a crucial role in our immune health, and lymph nodes are like little guardians stationed throughout our body. They filter out harmful substances and house immune cells that fight off infections. So, it's perfectly normal for lymph nodes in your neck to swell when you're fighting an infection, right? But what if they stay swollen long after you've recovered or there's no infection at all? That's when it's time to pay closer attention. Imagine feeling a small, pea-sized lump in your neck that wasn't there before. It might be tender to the touch, or you might not even notice it unless you're feeling around. Persistent swelling, especially when it's not related to a cold or sore throat, could be your body's way of warning you about something deeper, like cancer. If these swollen glands don't go down after a few weeks, it's definitely worth checking with a healthcare provider. They can examine your lymph nodes, ask about your medical history, and determine if further investigation is needed. Remember, early detection is crucial. Chapter 6. Ear Pain. This one might surprise you, but ear pain can actually be a sign of throat cancer. Now, I know what you're thinking. Dr. Mike, how can my ear hurt if the problem is in my throat? Well, it all comes down to anatomy. The throat and ears share nerves, so issues in the throat can cause pain to radiate to the ears. It's like a domino effect, where a problem in one area can trigger symptoms in another seemingly unrelated area. Imagine this. You've been experiencing a persistent earache, but there's no sign of an ear infection. You've tried ear drops, over-the-counter pain relievers, but nothing seems to provide lasting relief. This is where the connection to throat cancer comes in. If you're dealing with persistent, unexplained ear pain, especially on one side, it's a warning sign that shouldn't be brushed off. So, what should you do? If you have persistent ear pain, especially if it's accompanied by other symptoms like a sore throat, difficulty swallowing, or voice changes, it's crucial to consult with your doctor. They can examine your ears, nose, and throat to determine the underlying cause of your discomfort. Chapter 7. Lump in the neck or throat. Now, this last sign might seem like the most obvious, but it's important to address it nonetheless. Discovering a lump in your neck or throat can be a jarring experience, and it's natural to feel a surge of anxiety. Unlike swollen lymph nodes from infections, a lump related to throat cancer is often painless and can be a visible sign that something is seriously wrong. Imagine running your fingers along your neck and feeling a hard, immobile lump just beneath the surface of your skin. It might be small and barely noticeable, or it could be larger and more prominent. It's crucial not to ignore this sign, even if it's not causing discomfort, as it could indicate a developing tumor. Think of it this way. A lump in your neck or throat is like an uninvited guest that has taken up residence in your body. You wouldn't ignore a stranger in your house, would you? So what should you do if you discover a lump? First and foremost, don't panic. While it's essential to have it checked out, it's important to remember that not all lumps are cancerous. Schedule an appointment with your doctor as soon as possible. And there you have it. The 7 hidden signs of throat cancer you should never ignore. Remember, early detection of throat cancer can make all the difference in your treatment and recovery. If you've noticed any of these symptoms lingering for more than a couple of weeks, don't hesitate to seek medical advice. Being proactive about your health could save your life. If you found this information helpful, please give us a thumbs up and consider subscribing for more health tips and medical insights. And don't forget to hit that notification bell so you never miss a new video. Stay informed, stay healthy, and I'll see you in the next one.